Hello, I'm Dr. James. Today we need to have a frank and important conversation about a disease that is often called a silent killer, pancreatic cancer. But while it's true that its advanced stages are notoriously difficult to treat, this cancer is not always silent. Sometimes it sends out subtle, early signals. Recognizing these signals is a powerful tool. It can empower you to seek help sooner, leading to earlier intervention and, most importantly, better outcomes. This video is not about creating fear. It's about fostering vigilant awareness. It's about giving you the knowledge you need to be your own best health advocate. Let's begin by decoding some of these subtle, but critical, early warnings. It's important to understand not just what the symptoms are, but why they happen. One of the most common, and often dismissed, early signs is unexplained weight loss. You might find yourself losing 5, 10, or even 15 pounds without changing your diet or exercise routine. This isn't a welcome surprise. It's a red flag. This happens because the growing cancer is metabolically active, consuming your body's energy and nutrients at an accelerated rate. This is often paired with a significant loss of appetite, a feeling of fullness after eating very little, or a new aversion to foods you once enjoyed. Your body is sending a signal that something is profoundly wrong with its energy balance. Another crucial signal that requires immediate attention is the sudden development of diabetes, especially if you are over the age of 50 and have no other risk factors like obesity or a strong family history of the disease. Equally concerning is a sudden, dramatic worsening of pre-existing, well-controlled diabetes. If you've managed your blood sugar for years with diet or medication and suddenly find your levels are erratic and difficult to control, this is a significant warning. The pancreas produces insulin, the hormone that regulates blood sugar. A tumor growing on the pancreas can damage or destroy these insulin-producing cells, leading to these abrupt and unexplained changes in your glucose metabolism. Think of it as a direct message from the organ itself. Now, let's talk about pain. The pain associated with early pancreatic cancer is often vague and easily mistaken for something else. You might experience a persistent, dull ache in your upper abdomen, just below your breastbone. This discomfort may radiate through to your mid-back. It's a deep gnawing pain that isn't relieved by changing position or taking standard antacids. This happens because the pancreas is located deep within the abdomen, near the spine. As a tumor grows, it can press on surrounding organs, tissues, and major nerves, causing this characteristic pain. The key here is persistence. It's not the occasional stomachache. It's a discomfort that lingers day after day, week after week. One of the most specific, and often one of the earliest, signs is jaundice. This is a yellowing of the skin and the whites of the eyes. You might notice it first in the mirror one morning. Jaundice occurs when a tumor, particularly one in the head of the pancreas, grows large enough to block the common bile duct. This duct carries bile, a digestive fluid produced by the liver, to the small intestine. When it's blocked, a substance in the bile called bilirubin builds up in your bloodstream and gets deposited in your skin and eyes, causing that yellow discoloration. This is a clear, physical sign that a fundamental digestive process has been obstructed. The blockage of the bile duct leads to other telltale changes. Pay close attention to your bowel movements and the color of your urine, because bile, which gives stool its normal brown color, is not reaching the intestines. Stools may become pale, clay-colored, or gray. They might also appear greasy or oily and float in the toilet bowl. This is called steatorrhea, and it happens because fats are not being properly digested. Simultaneously, as the excess bilirubin is filtered out by your kidneys, your urine may become very dark, appearing brown or the color of tea. These two symptoms, pale stools and dark urine, occurring together, are a classic sign of bile duct obstruction and should never be ignored. Finally, consider persistent digestive issues that don't respond to typical treatments. This might be a feeling of indigestion, heartburn, or nausea that just won't go away. You might feel bloated or uncomfortably full even after small meals. These symptoms arise because the tumor can press on the stomach or interfere with the pancreas's production of digestive enzymes, which are crucial for breaking down food. While these symptoms are incredibly common and usually benign, their new and persistent nature is what makes them a potential warning sign in this context. If you never had acid reflux and suddenly develop a severe case that doesn't improve with medication, it warrants a deeper investigation. Now, I want to introduce a crucial concept: the symptom cluster. It is extremely important to understand this. Any one of these symptoms, in isolation, is far more likely to be caused by a less serious condition. Unexplained weight loss could be due to stress, back pain could be a muscle strain, indigestion is incredibly common. However, the concern for pancreatic cancer escalates dramatically when you experience a cluster of these symptoms. If you have new, persistent, and unexplained abdominal pain, coupled with sudden weight loss and changes in your stool, that is a pattern. If you are newly diagnosed with diabetes and are also experiencing jaundice, that is a pattern. It is this pattern recognition, the combination of two or more of these new and persistent symptoms, that should trigger an urgent call to your doctor. Do not dismiss the pattern. While this cancer can affect anyone, certain individuals should be especially vigilant. Your risk is higher if you have a strong family history of pancreatic cancer, meaning a first-degree relative like a parent, sibling, or child who has had the disease. Certain known genetic syndromes, such as mutations in the BRCA1 or BRCA2 genes, or Lynch syndrome, also significantly increase risk. Other major risk factors include a personal history of chronic pancreatitis, which is long-term inflammation of the pancreas, and long-standing diabetes of more than 5 years. Lifestyle factors also play a critical role. Smoking, for instance, doubles the risk of pancreatic cancer. And finally, age is a factor, with the vast majority of cases occurring in people over the age of 60. If you fall into one or more of these categories, your level of awareness should be heightened. So, what is your action plan? If this video has raised a concern for you, if you are experiencing a cluster of these persistent symptoms, here is a clear, step-by-step guide. First, do not panic, but do act. Get a notebook or use your phone and document your symptoms. Write down what they are, when they started, how often they occur, and what, if anything, makes them better or worse. Be specific. Dull ache in my upper abdomen. Started 3 weeks ago. Worse after eating. Also lost 8 pounds without trying. This detailed record is invaluable. Second, schedule an appointment with your primary care physician immediately. Do not wait a few more weeks to see if it goes away. Third, and this is the most critical step, you must be a clear and direct self-advocate in that appointment. Don't be timid. State your concerns plainly. A powerful way to phrase it is, "Doctor, I am concerned about the possibility of pancreatic cancer. I am saying this because I have been experiencing X, Y, and Z symptoms. They are new for me, and they have been persistent for the last several weeks." By using this direct language, you ensure your concerns are taken seriously and that the appropriate diagnostic investigation is initiated. In closing, I want to reiterate that the purpose of this information is to empower you, not to cause anxiety. Knowledge is your greatest ally in your health journey. The vast majority of people with these symptoms will not have pancreatic cancer, but for the few who do, recognizing the pattern and seeking help early can make all the difference. Early investigation is always the best course of action for any new, persistent, and unexplained health change. Listen to your body, trust your instincts, and be a proactive partner in your own healthcare. Thank you for your time.